Hello friends, Michael Levine with Without Notes, the unscripted TV show, revealing television interview show, and I today have the privilege of talking to a very interesting man, Dr. J. Grossman, a military veteran who began a charity many years ago called Homeless Not Toothless, and the journey and the story about how it all unfolded and how it's been so transformative, I think, is one that you're going to find quite interesting. Tell me now the story, or the embryonic story, of how you got the idea to begin a charity whose mission was to work with and assist homeless people at a time in which the problem of homelessness was nothing in any way as grave as it is today.
Yeah.
Talk about that story.
So, as you know, we're in my practice here in Brentwood. The VA is literally walking distance from us.
Accurate.
And
Veterans building in Los Angeles, rather large.
correct.
Mm-hmm.
So, and I passed it every day.
Yep.
So I'm starting my practice. I have more time on my hands than I know what to do with. I mean, Michael, sometimes I saw 1 or 2 patients a day,
Yeah.
right? So I've got these holes, and I'm making phone calls. And I'm driving by the VA, and as you know, there's always somebody at the corner, at the light, with a sign. And it says something like, "Veteran, will you help?" So here are all the thoughts that go through my mind. Are you really a veteran? Do you really need help? Is the money going to food or drugs and alcohol? Can you think of anything else that would go through your mind? Are those the...
No. And my intuition on all of them is probably no. But go ahead.
So I'm feeling, I have mixed feelings.
Sure.
Do I give them $1 because I feel guilty? Do I give them $1 because I would rather...
And by the way, you were guilty particularly by virtue of the fact that you were a veteran.
When I was active duty, I treated them for free.
Yeah.
They had a benefit. Now somehow they don't have benefits. Now, one of the things that I've learned after doing this nonprofit for over 30 years is that if you finish a full 20 years of military service, you have full benefits.
For life.
For life, medical and dental. If you're less than 20 years,
So if you're 15 years.
anything less than 20 years, you get no benefits unless you have a disability. Now, the military has an interesting policy for disability. If you're active duty and a part of your body got injured, they assign a percentage of disability to it.
Yep.
And if that percentage is, I think, over 20%, you get medical benefits. But the only way you get dental is if you're 100% disabled.
Wow.
So most people do not finish a full 20 years, and most people don't have 100% disability, which means you've got a lot of veterans that are out of the service that have no dental.
That's a great explanation for a certain situation. Okay, so now you're plagued. You're thinking, should I give them $1? Should I not give them $1? You're learning about why veterans disproportionately have that. What do you decide?
There were a few days that I gave $1.
So you'd walk by, give $1, knowing damn well that there was some chance, or even a good chance, that was going to go to booze.
And then I was reaching into my wallet one day, and I said, if I am feeding an addiction, I'm enabling and I'm not helping.
There is a vast number of the audience members that I imagine would resonate to that.
So I'm staring at my wallet, and right next to my dollar bill is my business card.
Mm-hmm.
And in that moment, Homeless Not Toothless was born.
And no other explanation than that. So now you pull not the $1 out of your wallet, but you pull the business card out.
Pulled my business card. I got a chill thinking about it, Michael. Like the nonprofit was. I didn't know it was going to be a nonprofit. Of
course.
But the
you
concept.
You didn't know anything. I mean,
Right.
except that you were going to give them your card. And say what?
I said, you know, I could do so much more for you by fixing your mouth, by getting you out of pain so you don't have to look for drugs, by giving you a smile so you could go get a job. Much more so than the dollar's going to give you. And my office is a block away. Now, here was the benefit of doing that. If they truly wanted to get off the street and looked at fixing their smile as one of the avenues for doing it, they would show up.
There's a qualifier. Right. The first rule of success is attendance.
Yes.
So if
Showing up.
If he shows up, or I guess it could be she too, but if he shows up, then you have an understanding that he's serious. Now so did the first guy show up?
I don't know if it was the first guy.
But ultimately, after enough cards,
people showed up.
People showed up.
And it also, I got to tell you, it also alleviated some guilt. Like, we pass by people who are begging all the time.
Right.
And so many of us look at them as subhuman. Like, get off the street, do something.
Yeah.
Right? Whatever that conversation
Correct.
is. And I was disgusted by that. I'm like, how can I just pass another human being out? What happens if I'm down on my luck? What happens if I could?
Wait. Doctor, there is a feeling among many people, you know it, I know it, you won't say it, I just did, that many of the people that are on the street are there, not all, but many, due to a sequential series of bad decision making, right? You didn't put him there. I didn't put him there. This down on your luck theory has some application for some, but some of them. So how do you tell me about your thinking process?
Let's go a little
about
bit deeper into that.
Okay.
I believe that the vast majority of these bad luck decisions has to do with mental illness.
Okay.
Okay. Now, if we consider mental illness an illness,
Yes.
just as we would consider cancer an illness, if somebody was going through chemo that you knew,
Yes.
and they excused themselves to go to the bathroom to throw up from their chemo,
Yes.
would you have empathy for them?
Of course.
Okay. So now we've got somebody who's got another illness that many of us are having a much harder time grappling because they just snap out of it. But what happens if they can't snap out of it? What if they really, really need help? What happens if they need therapy or medication, but they don't have access to it?
Would you then argue that often that becomes the case, from your experience, predicated on some trauma induced in military service?
The amount of people that I've treated that are veterans that have PTSD as their diagnosis is extreme. Percentage-wise, it's extreme.
But doctor, my question to you is this. Historically, there was this war called World War II. It used to be in all the papers. And it didn't seem that the veterans who came home from that war had the same degree of trauma that many of the people indicate today. So can we talk about that?
Yeah, I don't know if I necessarily have that expertise, but I would also guess that a lot of that had to do with we didn't know how to define what their trauma was.
Okay.
I think a lot of that was undiagnosed.
Okay. All right.
So when we take a look, for example, at the suicide rate in the veteran community,
Yep.
why is it 2 to 3 times the normal population?
Why wasn't it 2 or 3 times the population 40 years ago?
I don't know if I have the answer, but the other question that I would ask about that is, were we properly documenting their cause of death?
And that's a very fair question.
So I can't really go into that. I don't have that expertise.
But your point here is that there is a person, a fellow brother in the military. We think in terms
that
of
lingo,
brothers
sure.
and sisters. That's a vernacular. So we have a fellow brother Now, we first have to establish if he really is a veteran. And then we invite him into the dental practice because we're going to help this brother or sister start the journey back toward a productive life. Right?
Correct.
Because it's hard to get a job without teeth.
It is.
Generally. Okay. So now, when do you start to establish, because this is an intriguing piece to the puzzle in my mind, when do you start to establish certain criteria? When do you adopt because you're talking in such poetic ways about empathy, beautifully spoken, attaching chemotherapy and cancer to mental illness, all well stated. But at some point you adopt a bit more of a tough love logic.
Yes.
And I am fascinated by that, and I want to know, one, how you decided to do it, and two, how did it work out?
Yeah. So I think I have to credit one of our board members for helping me with that, and that's the actress Sharon Stone.
So you have a board. This Homeless Not Toothless.org has a board, and the actress, the very famous actress Sharon Stone, is a board member?
She is.
You're a beautiful board member. So then what does actress Sharon Stone say to you that indicates that tough love might be a better plan?
Yeah, she is, she's really a force to be reckoned with. She is powerful. She's got some very strong opinions that are really well situated when it comes down to compassion with boundaries. And when I heard her speak those words, I'm like, yeah, we need boundaries. We need to have criteria.
Prior to Sharon Stone, do you feel you were too heavily weighted in hindsight on compassion?
I was anybody who came in. You know, I wanted to help, but I was also looking at what is the help?
What is help?
What is help? Exactly. It's exactly
and
right.
you've defined, this is important for the audience, help is empowerment for, it is they who got themselves there, albeit through a difficult circumstance, and it is they who are going to get themselves out. And you
Empowerment, not enablement.
Empowerment, not enablement.
Exactly.
Dear friends, thank you very much for your time, a very valuable commodity in today's busy world. Thank you. If you enjoyed this, please share it on social media, discuss it, engage with it, talk about it, debate it, and stay tuned, if I might invite you, for a concluding episode, which really is a valuable one in my mind.